Well, now, what are the statistics of people who do use the alternative therapies?
Well, it depends on what it is. If they are for, like, if in my area where we're looking at people who are treated for heart disease without bypass, I probably have turned more people away from bypass than anyone in the country.
You're kidding.
No, I mean, we get a second opinion on bypass, almost daily, where we, most of the time, because their heart is functioning okay, their pain is not severe, they're well controlled, and they change their diet and things like this, we are very successful. It's not hard to successfully treat patients told to have bypass or angioplasty and at least equal the success that they would have had if they had the surgery, because we know that bypass surgery and angioplasty just does not prolong life.
Well, it has a lot of other complications, but how do you know that not treating it has a higher, or if not the same, success rate? How do you know that?
Well, there are studies on that are very clear. There's studies back in 1983. The CASH study showed that people who had the bypass compared with people who just did not have bypass and had standard. There was no benefit at all. We also know the death rates. If you're like a bypass candidate, your death rate from a heart attack on a yearly basis is about 1 to 2% a year. That means if you've been told to have bypass, your chances of dying each year may be about 1 out of 100 or 2 out of 100 per year. Well, the surgery itself has a 3 to 4% death rate. So,
what about emergency surgery?
Emergency surgery is not, in my opinion, emergency surgery should not be done.
Should not exist?
No, because they keep studying this. What you should do with patients that come in with a heart attack is give them nitroglycerin, put them at bed rest, give them some magnesium, stabilize the individual. And studies have been done to show that once you become much more aggressive, the death rate in the hospital goes up. And if you don't die following the surgery, everybody's, jumping around and spitting out wood nickels saying we saved your life, which just meant that, that they happened to survive not only the heart attack but also the aggressive surgery.
That is quite an invasive surgery. My mother actually had open heart surgery, triple bypass, about 3 months ago. And I asked the physician after the surgery, I point blank said to him, if you had not performed the surgery, what was the likelihood of my mother having a heart attack?
And I can tell you what he said. The likelihood of her dying would have been 100%.
That's exactly what he said.
They always say that. They always say that, and it is an absolute lie. And they know it's a lie.
But it maybe was what I wanted to hear.
Well, it did the trick.
She went
happy,
through it.
Your mom's happy. So it did the trick.
And she was alive.
Yep.
So, yes,
she was alive.
That was all I did need to hear at that point, and so did my mom and my family. But the whole idea of, did she need to go into it in the first place? There could have probably been some other measures that could have been made.
I can absolutely promise you there could have been, but you would not have had access to them in any hospital in this country, because in this country they are committed to aggressive use of surgery, and you're looking at close to a multi-$100 billion industry, and there's no way that they put this injury at risk by not doing surgery on people that they can get compliance to go into surgery for.